Welcome to the Nutritious and Delicious podcast. I'm Bethany and I'm your host, and welcome. So, I've been in the space for over 17 years as a previous health nurse and now a certified holistic nutritional consultant. I help clients with their hormone health, fertility, and family health. Join us on this journey as we connect with experts from around the globe, sharing insights and personal stories along the way. So, today I'm here with the amazing Rashida. So, welcome, Rashida.
Thank you for having me.
Yeah. So Rashida is actually a homeopathic practitioner. She's actually been doing this for 20 years and she is a member of the Canadian Society of Homeopaths. Rashida actually combines a background in cellular and molecular biology with homeopathic expertise to manage a range of conditions, including genetic disorders, hormonal imbalances, mood disorders, and much more. So I'm super excited to talk to her today because the podcast topic is all about understanding hormones and our health. And I think that's super important. So I'm going to just start with a question here for you is what types of hormonal complications do you commonly see in women who are prescribed birth control, both while they're on it and obviously while they're coming off of it as well?
Uh, there are various complications I have seen in my clients when they come to see me for their hormonal imbalances. But first, I want to clarify most of the patients or most of my clients they come to see me after weaning off these pills. And also, I want to add that these pills, like they were given these pills not only for their um, not only for to prevent pregnancy, but also it is given for mood disorders and premenstrual symptoms, acne, painful periods or dysmenorrhea, or PCOS, which is polycystic ovarian syndrome.
Mm-hmm.
And I think, in my experience, when they come to see me, they already have problems and complications from these pills.
Right. So it seems like a lot of women, like this is what I've been hearing as well. Kind of, it's like the standard of, I guess, going to like the doctor is like, I have, I feel kind of my mood is all over the place. I have acne. I have painful periods, and the first thing they prescribe is birth control. Correct?
Yeah.
Okay. So what like while they're on it and when they're coming off of it, what the other thing I've noticed too, especially with women as well in terms of birth control is they'll go on birth control, but then only to discover that the birth control is actually giving them worse symptoms or a different type of
Yeah.
symptom. So what's sort of happening there, like it's adjusting their body. So for example, somebody that has PCOS or endometriosis, let's say for example, they would probably have a different experience being on the same type of birth control pills. what would
Yeah.
what would sort of that what would sort of happen if they went on birth control for someone with PCOS versus endometriosis?
Um, for PCOS, they have lots of different issues. They have hair growth on their face and on their body um, because of high level of androgens, which is a male hormone,
Right.
especially testosterone. And also they have weight gain because of the insulin resistance.
Right.
They have other issues. Irregular menses.
Right.
And for endometriosis, if we talk about, because it's a chronic inflammatory condition, and despite of taking these pills, they still have some other issues because in endometriosis, the growth of the lining of the uterus, it goes to different places. For example, if somebody has this type of growth around their bladder, then they have difficulty uh, during urination, especially around their menstrual periods.
Okay, good to know.
Yeah,
That's something I didn't like. I know it grows outside of the uterus, but it
yeah.
affects different organs. I've heard it grow into. Does it also grow into the gut as well?
Uh, I'm not sure about it, but I think it depends because bladder, it can go around bladder, and then if it becomes worse, it's possible. Yeah, but
Yeah.
not in my experience. Yeah.
Okay, because that's obviously pretty far gone in the sense.
Yeah.
So what symptoms do your patients with PCOS and endometriosis typically experience? And what hormonal imbalances are taking place sort of in these conditions? We talked a little about the PCOS, so let's kind of do that
Yeah.
one first. So I personally have PCOS myself, so I understand a lot
Yeah.
about that. It's an imbalance with testosterone, androgens, all that. So kind of from a homeopathic standpoint, can you sort of like talk about like what's happening to the body and why this starts in the first place, maybe?
Mm, Sometimes it's difficult to find out the real cause of these
Yeah.
hormonal issues. For PCOS, I know I had a patient who had difficulty with fertility
Yeah.
because of I think I think her ovulation uh, was not like
And
in
that's why
balance.
they're
Yeah.
not having periods as well. They skip a lot of periods because of
Skip.
the hormonal
Yeah.
imbalance.
Yeah, sometimes they skip, but in most cases they have irregular periods.
Yeah.
And if they don't have a proper ovulation, it's like if they don't have a mature egg, which is releasing on the time, like on 14 days, then they have issue. It's possible that they have issue with fertility.
Right. And I see that
Yeah,
quite often as well, unfortunately.
yeah.
With the endometriosis, what's sort of happening with the hormones in the body, and is this something like, are these both sort of genetic that are coming from family members, or do you find that it's like kind of the environment, the diet, things that are happening?
Yeah, I think for endometriosis, is a genetic. Um, and also I want to say for endometriosis, sorry, it's because of the estrogen dominance. And when we have a high level of estrogen, then it's difficult to balance estrogen and progesterone in our body. And also, I think if you talk about the environmental, it's a big factor. Due to my background in cellular molecular biology, I learned about environmental science, and I learned that we are exposed to chemicals in our daily lives.
Yeah.
Therefore, it's very easy, or it's very like prevalence. It's very prevalence that we can see these type of hormonal issues these days. Um,
Do you think it's like due to like the plastic increasing? Because I've heard that a lot with
yeah,
estrogen
yeah,
dominant.
yeah.
Like, is that like, does that play a factor, or is it kind of
Y-
even just the environment, like the toxins that are going on in the air right now?
it's one of the factors. Yeah,
Yeah.
plastic is one of the factors. I think non-stick pans, because we are cooking in non-stick pans, and there are lots of chemicals even in our water. We are exposed to chemicals through our drinking water. Even though in Canada it's very clean water still, and from using plastic containers, plastic bottles, there are many things in
And
our environment.
it
Yeah,
disrupts the hormones and
yeah.
it's inflammation. So when you say like endometriosis has like a lot of inflammation, are you seeing that sort of in their gut and their skin? Because I don't see as much, I would say, acne with endometriosis,
No, no, no.
but there seems
Yeah.
to be a lot of like gut issues. What I've noticed, or women saying that their belly is really big for some reason.
I in my experience, like they have painful periods, which
Yeah,
is like even despite of taking painkillers, they are not working, and
yeah.
it's a huge challenge for them because it impact their lifestyle. They can miss their work and school, which is not good. Yeah.
No. Um,
And I think, sorry, you
yeah.
said about something gut. I think it's very related. In homeopathy, we consider everything. We treat a person like whole person, not only one part of that
Right.
person. Yeah,
And that's sort of the difference, I think, with the holistic medicine, which I really like,
yeah,
and what you do, because you're not sort of looking at just like one system and saying, okay,
yeah,
well, here's some pain medication that will help, but it doesn't sort of fix the problem, like you said.
yeah.
So, with that, what kind of homeopathic solutions do you find helpful in correcting these hormonal imbalances, whether it's maybe you're dealing with PCOS or maybe you're dealing with endometriosis? I would imagine that they're kind of different how you treat them.
Yeah, they are very helpful. In my treatment plan or strategies, I combine three or four strategy depending on the my client's symptoms and situation. Because first, I need to consider their physical, mental, emotional health. I need to take everything, like I need to consider every of their symptoms, so I can treat a whole person, as I said earlier. And the
Hmm.
other thing, I also give some homeopathic remedies which can antidote the side effects of previously taken medicine. And the third thing, that in homeopathy we have sour codes which are very helpful. They are made from they are prepared from healthy organ or healthy tissue or healthy secretions, such as from hormones. And if I feel that my patient need that sarcos, I also add, um, I also give that one, depending on the, like, the symptoms. And I was very successful in helping my patient, one of my patient, who had difficulty with ovulation, and then she had a lots of pain, and it was very difficult for her doctor to diagnose what's going on inside, because sometimes they said, oh, there is a cyst, and next time they said, no, they have a, like, they are saying different things. It's very difficult for them to diagnose, but homeopathic medicine helped her a lot.
That's great. It's for my own journey with PCOS. I was undiagnosed for ages too, and I kept sort of going in saying I have these symptoms, but I wasn't showing sort of the typical like weight gain, hair, things like
Yeah,
that. And
yeah,
then it was the only thing I had was sort of like the jawline acne, which I suffered with for years, like as a teenager and
yeah,
stuff too, and into my adulthood, which I found weird. But
yeah,
again, went for scans, ultrasounds, all that kind of stuff, and nothing was there. So they kept sort of misdiagnosing it, and just putting it down to maybe diet or something else. But I was eating super clean, wasn't eating
yeah,
dairy, like trying to keep my hormones under wraps. It's hard, and I've spoken to a couple of doctors too that deal with like the endometriosis, and they say I believe it's like 7 to 10 years like it takes for an actual
yeah,
diagnosis, and it's quite
yeah,
invasive the way they do it as
yeah,
well. So, um, I it's almost like I think women have to kind of like tune into their symptoms, like you mentioned. If you're sort of leaning towards more like hair growth, like acne,
yeah,
maybe bald spots in your
yeah,
hair, because
that's true.
testosterone does that too.
Yeah,
Not like ovulating, like not getting pregnant, maybe that's one thing. And also maybe skipping periods, that
yeah,
may be kind of leaning to more the PCOS, male testosterone kind of levels.
yeah,
The endometriosis, from what I hear, it's more really heavy, painful periods. You're missing
yeah,
school, you're missing work. Um, I hear like belly bloating a lot, just with foods in general. So that could be part of the inflammation in the gut.
yeah, mm,
Maybe if somebody in your family, like women on your side of the family,
yeah.
has like, endometriosis themselves, um, different things like that. Is there other things I'm missing with the endometriosis in terms of like what about moods and stuff? Is there different types of moods for different issues? Like,
Uh, it's possible, but I think with PCOS we have mood disorders, but endometriosis is like a very pathological and chronic condition. It's possible to have a variety of symptoms in different patients. Not
yeah,
every person can show the similar symptom, like it's possible to see a range of symptoms, but I think in my experience I see more painful periods. And
right.
what you said about the gut, I think gut is very important these days. I have seen lots of patients, whether they are male or female, they have gut issues.
Yes.
Bloating and acidity is very common, constipation is very common, and I think they are everything is interrelated, connected. Yeah,
From what I've seen too, working in the nutrition space, I found from the last several years with like the heavy stress around the world, obviously with
yeah,
going through a pandemic, I think the anxiety and the depression went up massively. And what I
yeah,
noticed was it kind of changed two things. It was it didn't change it changed the gut microbiome basically, because when we're
yeah,
anxious and depressed, it does
yeah,
change our stress levels, and we don't have a lot of good healthy bacteria in there anymore. So then we have kind of a lot more different digestive issues, like you mentioned, constipation, diarrhea, all that kind of stuff, IBS. um, the other thing was also, I think, with that stress, it changed hormone imbalances, and a lot of people gravitated towards eating really poorly because they didn't feel good. So they were trying to sort of increase their serotonin levels to to be happier, right? And
Yeah,
especially women as well. Around that time of the month, when they are on their period, they crave more chocolate, they crave more salty foods,
yeah,
and it's kind of the worst thing because that's sort of bloating us, making us more susceptible to acne and things like that. So it's actually like hindering sort of the progress. So how do you sort of support women with hormonal imbalances, like in a long term sense, through homeopathy? And what kind of results have you seen in your practice?
In my practice, I support women with homeopathic remedies mainly, but I also advise them to make lifestyle changes or try to minimize their exposure to chemicals in their daily lives. I think it's very important, and we are ignoring these things even for children. Even it's not only for women; it's only for children, like female um, girls, like for girls and boys, they need to have less exposure. We, our children, they are have this type of exposure through plastic toys, and we
Right.
have lots of hormonal issues in females, and also we have similar type of issues in male. Like I know and I learned from the research that um, male are they have low sperm count, which is not good for their, like, later in their life
Right.
after, when they want to have children.
So this is
Yeah.
children that you're talking about with being exposed to, like you said, environmental like plastics.
Yeah, plastic toys, they have lots of chemicals. And for women, because we need to be careful, we don't need to think when the puberty start, then we need to think about, we need to educate our families, our women, our, like, we need to educate our mothers so
Right.
they know, because sometimes it's difficult when the problems start, it's difficult to handle it. It's better to educate our families, and so they have less exposure to these chemicals. And other thing, in my experience, I think, I feel the homeopathy medicine are very helpful, and especially if we make lifestyle changes, as you are a dietitian and nutritionist, if people, they think about, they consider about their diet, if they avoid inflammatory food which can cause
Yeah.
inflammation, is very helpful for them.
Yeah.
And if women, they use homeopathic medicine, like my clients, if they use homeopathic medicine and they get better, they don't need to use it. If the symptoms come back, they can contact me, or I already guide them. Okay, if it happens, you can take this medicine again, or they take this remedy.
Right.
Yeah,
So it's
it's
a
not like you, they don't need to take it for their whole life. It's not
right.
like that.
So it's
Yeah,
just a way of sort of like helping them like ease into like helping their body kind of get back to sort of like the homeostasis, basically the
yeah,
normal kind of
homeostasis. Yeah,
basically. The other one I
yeah.
was going to ask you as well, because you were talking about pain medication. So with endometriosis, what are your thoughts on arnica as a homeopathic for pain? Do you do that
uh,
for women?
Arnica is a very good medicine for pain, but it's more for muscle pain.
Oh,
For,
okay.
yeah, for like like for period pains, we have other medicine, like we have magnesia fast, which is very helpful. Very, very helpful, I can say, because it's, I have this experience. If they use magnesia fast, it's a, like a tissue salt, or cell salt, we call it, and we can use it in 6x, or even we can use in potency like 30, 200 C. It's very helpful for females in their menstrual periods. But
Right.
there are lots of other medicine depending on the symptoms. Magnesia fast is a, like a general medicine which anybody can use. And in magnesia fast, in this homeopathic form or biochemic form, it is helpful for those ladies who have pain, which is better with heating pad or with warm bottle.
Mm-hmm.
Yeah. Yeah.
For ladies that are trying, because there's a lot of women listening to this that are like on a fertility journey, they're struggling. Are they able to take homeopathic medicine while they're trying to get pregnant? Like, does that work, or do you talk to women while they're trying to sort of get pregnant? Like, how does that work?
Yeah. Most of the medicine they work. Only some of the medicine we need to be careful, but they can take homeopathic medicine with their conventional medicines. Yeah.
Okay. So that's a good thing to know. So I always encourage everybody to go and talk to somebody like Rashida, who actually is trained in homeopathy. So you understand and not
Yeah.
just buy things, because I think a lot of the time people read stuff on Google and they go and buy supplements. And then I'm asking
Yeah.
them, like, why are they taking it? And they're not really understanding. And then they're sort of
Yeah.
unbalancing other things in their body.
Yeah.
So that's why, like, I like having people like yourself come on. So thank you so much for coming on the show today. Did you have any other words of wisdom for anybody today?
Mm, I think health is very important, and usually we ignore it because we are very busy in our
Yeah.
daily lives, and we are living in a competitive world. But I think health is the most important thing, and we should consider it. We should not ignore it. Yeah.
Well, that's what we have at the end of the day is our health. Like, if we
Yeah.
don't have our health, we don't have
Yeah.
anything. So
Yeah.
I appreciate you coming on today. Where can our listeners find you?
They can visit my website www.acrowellness.ca, acro wellness.ca, and they can also reach me at Instagram, Facebook, LinkedIn. They can DM me. Yeah,
So
direct message me.
acrowellness.ca. So I'll put all that in the show notes for everybody.
Yeah.
So thank you so much and stay tuned, everybody. Don't forget to like and subscribe so you never miss a show. In good health, everybody.
Yeah. Thank you very much for having me.